Hello everyone, happy evening, a very good evening. I hope and I believe all of you are doing well. So this is Dr. Nikita here for this next YouTube live session, a very important topic, that is Radioanatomy Top 10 Images. Before we proceed with the session, a quick nod whether the audio visual is all good. All right, thank you, Sri Lalita, for that quick nod. So now what's the plan for the day? For the next 30 minutes or so, we will have this radioanatomy top 10 images. Extremely important because you get at least one question from radioanatomy, especially FMGE exam and also a NEET PG and INICT exam. So until and unless our radioanatomy knowledge is clear, we won't be able to make a diagnosis on the radiological images. So radioanatomy forms the foundation of making a diagnosis on the radiological images. So we are going to see top 10 images, which includes your neuroradiology, few from musculoskeletal, chest radiology, abdominal radiology. So basically it is mixed bag here. All right, so what's the plan after this? As I said, 30 minutes we will have this session. So by 8:45 we will start the open house. What is open house? It's a podcast sort of thing, a audio class where we interact, and it's an AMA session, ask me anything session today itself, like yesterday we had. So you can ask me your queries, whatever queries you have, and then there would be a dose of motivation that would be also coming along like yesterday. Right, so everybody can attend the open house session. It's at 8:45 on the Unacademy app. The link has been shared on the Telegram group. All right, so let's start with this. And before we proceed, let me tell you the plan for tomorrow as well. So tomorrow, the plan is basically, all right. So the plan for tomorrow, similar 5 p.m., 8 p.m. and 8:45 p.m. That is, we have 5 p.m. It's a class on the app. It's a free special class, and it's KBMD, that is Kaun Banega MD. Long time we have not had fast 5 clinical lengthy questions, which helps you, how to read the lengthy questions quickly in limited time. We'll be talking about those skills. 8 p.m. we'll have the YouTube live session, emergency radiology, top 10 images again. Very important, which will include pneumothorax, pneumoperitoneum. Like no exam is complete without those images, right? Emergency radiology. And then 8:45, again, we will have open house like we are having today as well. All right. And after that, I hope all of you are registered for All India mock test, which is on February 26, 9 a.m. The unique feature being you will get video solutions to all the questions being provided by the respective subject educators. All right. And we are introducing notes for NEET PG. This will be for the students who've got at least 1 year plus subscription, and this is valid only till February 23. So make sure you make the best of it, and soon you are going to see the price hike. So let me tell you, so to avoid any regrets later on, grab your subscription soon before the prices go high. All right, and let's start with our today's session without any further delay. These are the new batches we have. FMG students, also for the next 2023, we are starting a batch tomorrow. And also for INICT, a 2-month course basically is what we are starting tomorrow. All of this is coming your way tomorrow. And in each of these batches, I would be catering to radiology, rapid revision for your exams. Okay, and this is what we have, the last slide here before I begin with the formal discussion. This is only till tomorrow. You have extra months provided with your subscriptions. With 3, it is 1 month extra. With 12, it is 2 months extra. 4 with 24 and 6 with 36. The longer the subscription you take, the more cost effective it is going to be for you. So the undergraduate students, 3rd year, final year, 2nd year, make sure you make the best of this offer which is available. So let's start with the discussion here. The first question, identify the labeled part. What do you think is the labeled part here? How to join open house? Maybe you can go to the app also, Dr. Happiness, directly. And at 8:45, you would see that an open house is going on. If you're not able to join by the link. Okay. Okay, so let's see Srishti and Murli and Nuzat, Nitin. So everyone has answered it correctly. The labeled part here is IVC. Okay, the labeled part here is IVC. Okay, so let's see if I can go back to that slide. Okay, so have a look at this image, guys. I hope all of you are able to see this. What are we seeing here is, this is a CT scan. Why do I call it a CT scan? Because the bone is white, right? The bone is white, so this is a CT scan. Now, is it a contrast enhanced CT? Yes, because this is the aorta which is white here, right? This is the aorta which is white here, as you can see. Now, whether this is gallbladder, this is IVC, what is it? To the right of aorta, right? Remember that this is your left, but basically this is patient's right side. In the radiological images, it's the opposite. So to the right of aorta, in front of the vertebra, we have the IVC. It's not the gallbladder. Where is the gallbladder? This structure which you see here, this is the gallbladder here, right? This is the gallbladder, because gallbladder contains bile, which is fluid. Fluid is like gray color on CT. So this gray color structure superficially located, right? Abdominal wall ke niche. It's a superficial organ. That is the gallbladder. IVC is located to the right of the aorta. Okay, remember that. So this is your IVC. This is the gallbladder. This structure here is the pancreas. Okay, that's the pancreas. Anterior to the IVC, can someone tell me what is this rounded structure here, this one? Can someone tell me what is that rounded structure there, anterior to the IVC? So you will see this splenic vein coming posterior to the pancreas, right? And it is forming the portal vein. It is not the SMA, it is the portal vein formation which is happening, the confluence that is happening. Okay, so IVC ke aage, that's the portal vein confluence. This is the kidney. So let's go back here. Everybody clear that this is IVC? This has been asked in one of your NEET PG exams 2 to 3 years back. Okay, let's go to the next question. Identify this structure. Is it ascending aorta? Is it descending aorta? Is it SVC or is it pulmonary artery? What do you think is the labeled structure here? Okay, I see some confusion here. Some students saying it is SVC, some students saying it is ascending aorta. Okay, now again, is it a CT scan or is it a MRI? What is it? So see here that this is a CT because the vertebra, the bone is white. Contrast enhanced CT, you can see the vessel is white. Okay, this is a contrast enhanced CT. Now, these are the vessels, the three major vessels going into the heart and coming out of the heart. Chest mein. Going into the heart, it's superior vena cava. Coming from the heart, you have the aorta and the pulmonary artery. Alright. Now, what happens is aorta is coming from the left ventricle, but it crosses pulmonary artery coming from the right ventricle and they both cross, right? We know that the spiral septum which is there. So they cross each other. So even though the aorta is coming from the left ventricle, but actually it is located to the right of the pulmonary artery. Okay? Now these three structures here which you see here, okay, so these three structures that you see here, this is the rightmost structure, right? This is your left, that is the patient's right. So this rightmost structure is your superior vena cava, which goes into the right atrium. So it's on the right side. Then in the middle, that's your ascending aorta to the right of the pulmonary artery, right? To the right of the pulmonary artery. Pulmonary artery can be identified by this inverted Y shape. Why does it have so? Because it is dividing into the right pulmonary artery and the left pulmonary artery, right? It's dividing into the right and the left. The artery which will enter, okay? The artery which will enter into the lungs is the pulmonary artery. That's what we are seeing here, okay? So that's what we are seeing. It's going into the right and the left. So please remember that from right to left, okay? So basically from right to left, the arrangement of structures is SAP. Okay, the arrangement of structures is SAP, that is superior vena cava, ascending aorta, and this is the pulmonary artery dividing into right and left. Now, where is the descending aorta? See, the aorta is located like this. You have ascending, you have arch, and you have descending. So, when I take an axial section, anteriorly we will have ascending aorta, posteriorly we will have descending aorta. So, this one which you see to the left of the vertebra, that is the descending aorta. Okay, so this is the descending aorta. This is the ascending aorta. As we can see here, okay, so is there any difference in the intensity of artery and vein on CT dental Q? Like you can see in this image, there is a slight difference because it basically depends on timing, at what timing you have taken the image, right? We give intravenous contrast, then it goes to the artery, it goes to the entire body. Based on आपने कितने time पे you have taken the image, it will depend on which vessel has more contrast, which one has less contrast. Okay. So remember that this is the ascending aorta in the anterior mediastinum, descending aorta in the posterior. Close to the vertebra, posterior would be descending. So everyone clear the four structures? We have identified those. Let's go to the next one now. Okay, so look at the next image. Keinbock's disease affects which of the bones? Bone label 1, 2, 6 or 4. Okay, no sir, this is not HRCT. Remember, HRCT is for the lung parenchyma. You would see the lung parenchyma very well. That was your soft tissue window, mediastinal window. Okay, so is it the bone labeled 1, 2, 3, 6, 4? What carpal bone is it? So first of all, here we need to know that Keinbock's disease, basically Keinbock's affects JK. When you say alphabetically GHIJKL, so remember Keinbock's affects the bone which is lunate. Okay, Keinbock's affects lunate. Now, how to identify the lunate? We know the mnemonic for the carpal bones. We all have read that. It is, she looks too pretty. Try to catch her. Okay. Remember that it's she looks too pretty. Try to catch her. Out of that, she looks too pretty. It is the proximal row. Very important to remember. It is the proximal row. Try to catch her is the distal row. Okay, this is the important point to remember. After that, also remember that she looks too pretty. It is from the radial side to the ulnar side. Okay, so she looks too pretty. Try to catch her. That is how it would be. So basically, you will have the wider bone radius here, the slender bone ulna here. So this is from radius to ulna. That is from lateral side to the medial side. Okay. So now look at this image here. Okay, look at the image that we have here. Okay. Let me go back to the image. Okay, so everyone able to see this image now? What do we see here? This is the radius bone. Okay, why do I call it as radius? Because the wider bone is the radius, the slender bone that is the ulna. From radius to ulna, it is she looks too, and that rounded bone that is pretty, pisiform. Okay, so proximal row, she looks too pretty. Distal row, try to catch her. Try to catch her. Remember, it's from radius to ulna. So this bone here, this is scaphoid. Okay, so this bone here, this is the scaphoid. This is the lunate. She looks. Now, in the carpal bones, you have 3 T's, right? In the carpal bones, you have 3 T's. If you look at the mnemonic here, 1 T, 1 T and 1 T. How do you know that which is triquetral, which is trapezium, which is trapezoid? Remember, she looks too. So this one, the third one is your tri. That is, this one is triquetral. Okay, this one is triquetral. So this becomes your triquetral bone. She looks too is triquetral. Tri 2, that is trapezium and trapezoid. So remember trapezium. It ends in UM, that is rhyming with thumb. So trapezium is towards the thumb, that is the first one. Trapezoid is the second one. Okay. So this one towards the thumb is going to be the trapezium and this one is trapezoid. The largest carpal bone that you can see out of all of these, which is the largest one? That is your capitate. Okay, the first carpal bone to ossify, that is your capitate, and you have tried to catch her, that is the hamate. Okay, that's the hamate. So Keinbock basically affects your lunate. So which is the lunate bone here? This is the lunate bone here, right? So that is why the answer is the bone label 2. Okay, the bone label 2. All right. So that was about this question. Let's go to the next one. Okay, this is interesting. Identify the labeled vessel here. Identify the labeled vessel. Is it PCA? Is it superior cerebellar artery? Is it pica or is it ICA? Okay, so who's getting it right? Very good. Nuzat, EF, I can see a lot of students. But basically, I can see there's a confusion also. Some students saying pica, some students saying it is ICA. Okay, so let me first quickly tell you the gist of how do we identify the arteries. So remember your PCA, SCA, pica and ICA. Out of that, basilar artery. Okay, so basilar artery gives what branches? Basilar is A and S. It gives your ICA. Okay, it gives your ICA and it gives your superior cerebellar artery. Also remember you can write basilar as basically pacillar. Okay, so remember it is posterior cerebral artery. So PCA, ICA and SCA are the branches of basilar artery. Pica is not a branch of basilar artery. Okay, so remember out of all of these, pica is not a branch of basilar. Pica is a branch of vertebral artery. Easy to remember. We have read in the today's KBMD also we saw lateral medullary syndrome, right? It is your occlusion of vertebral artery or its branch pica. So pica is a branch of vertebral. Now look at this image. What is this investigation? Our last YouTube series, Radiology Investigations. What investigation do you think is this? What do you think this is the investigation which is shown here? Sneha says it is DSA. No, it's not DSA. Very good, Milind. Absolutely right. It is your MR angiogram. Why this is not DSA? Number one, DSA, generally, at least for your level, remember, black contrast. Second, DSA is a catheter angiography. We put a catheter and then we do an angiogram. One side at a time. So you will not see all the vessels together. When we identify the anatomy, you are seeing the carotid, you are seeing vertebral, you are seeing both side vessels all together, which is not possible in DSA. It is possible with your cross-sectional imaging, that is MRI or CT. Right, so that's why this is not DSA. Because we don't see the white bones, that is why this is not CT angio. This is your MR angio because the white bones are not seen. Now let us identify the anatomy. These two vessels that you are seeing coming from either side, joining in the midline, that is the two vessels which come and join together are your vertebral artery. So this is the vertebral artery. Let me change the in color. Right, so this is the vertebral artery. Joining to form this vessel, which is the basilar artery. Right, this is the basilar artery. Basilar artery, when you see, what is the terminal branch of the basilar artery? Remember, that is your posterior cerebral artery. So this one is your PCA, posterior cerebral artery. The branch coming from the basilar. Now you have two more branches coming from basilar, this and this, right? This is the basilar artery. You have two more branches coming here. What are the branches we saw from basilar? PCA, ICA and SCA. Thinking logically, which one will be located superiorly? Superior cerebellar artery. Inferior cerebellar artery will be niche. So this branch is the superior cerebellar artery. The branch just below the PCA coming from the basilar, that is your superior cerebellar artery. Okay, superior cerebellar artery. So this branch will become your ICA because it's coming from the basilar, the inferior part of the basilar. So this is ICA. Tell me what branch is this? Coming from the vertebral. What branch is that? That is your pica. Okay, that's your pica coming from the vertebral. Clear with everyone? Okay. So let's see the next image. So identify the labeled vessel. The labeled vessel here is ICA. Okay, the labeled vessel here is ICA. Have a look at this image of MR angiogram again, right? You have the two vertebrals. Let me see if I can. Okay, so look at this image. So you have the two arteries which are joining together to form the basilar key subset terminal branch. That's going to be the PCA. Just uske niche is going to be the superior cerebellar. Inferior part of basilar, that's going to be the ICA. And you have the pica coming from the vertebral artery. Okay? Anterior spinal arteries. Okay, Dr. Akash, I'll show you in the next image. Let me show you the anterior spinal. So look at this image here. From the vertebral coming in towards the midline, right? That's going to be your anterior spinal artery. Okay. So this one which you see here, okay, coming from the vertebral but going medially, that is going to be the anterior spinal artery. The pica goes laterally. Okay, the pica goes laterally. Is that clear? So ASA would be your branch of vertebral but coming medially. Okay, coming medially. Alright, let's go to the next image now. Okay, ICA. Let me go back to that MR angioka image. So look at this image now. We are done with the posterior circulation. Coming to the anterior circulation. The tortuous vessel which you see here supplying the brain. The tortuous vessel on either side. That is your internal carotid artery. Look at the terminal branches. ICA is one branch going horizontal lateral. That is your MCA. Okay, that's your MCA. The branch going medially towards the center. That is the ACA. Okay, that's the ACA. So this is the MCA. This is the ACA. This is your internal carotid artery. Can someone tell me what is this artery here? Shown by the arrowhead. What is this artery here? Yes, Srishti, so very good. You remember all the points that we have discussed in our previous classes. Absolutely right, Nuzar. That is the posterior communicating. What does it communicate? Your internal carotid artery with the posterior cerebral artery. And PCOM is a branch of, from where is it coming? Is it coming from PCA or is it coming from ICA? From where is it coming? It comes from the ICA. Okay, it's a branch of the ICA and joins with the PCA. Okay, so that is a branch of ICA. Alright, let's go to the next question now. Identify the labeled part. What do you think is the labeled part? This is your early antenatal ultrasound. Is it the fetal pole? Is it the amnion? Is it the yolk sac? Or is it the gestational sac? Okay, so mixed answers here, some confusion. Majority of you are right. But I can see some confusion between option yolk sac and gestational sac. The correct answer here is this is the yolk sac. Okay, so the answer here is this is the yolk sac. How do you identify the yolk sac? See, this is your antenatal ultrasound. Okay, let me zoom this image. All of you can see the image here, right? So look at this. This is the antenatal ultrasound. This entire thing which you are seeing, that is containing everything. This is the gestational sac. Okay, this entire thing is the gestational sac. Now, in this gestational sac, this part which you see, that is the fetal pole. Okay, that's the fetal pole there, the embryo basically. This thin white line that you can see surrounding the fetal pole. Okay, that thin white structure, very, very thin white membrane sort of thing surrounding the fetus, that is your amnion. Okay, that's your amniotic cavity which surrounds the fetus. Outside the amniotic cavity, that is your yolk sac. Okay, so this rounded structure which has more thick rim compared to the amnion, outside the amnion, that small structure, that is the yolk sac. Okay, so what is the function of yolk sac? Hematopoiesis, providing nutrition to the fetal pole in the early weeks, right? And if you see a yolk sac within a gestational sac in the uterus, it's the first definitive sign of intrauterine pregnancy. Remember, what's the first definitive sign of intrauterine pregnancy? It's not your gestational sac. Okay, it's not your gestational sac. The first definitive sign of intrauterine pregnancy is the appearance of the yolk sac. It is the appearance of the yolk sac. It is not the gestational sac. Why? Because sometimes even in ectopic pregnancy, we can get pseudo-gestational sac in the uterus, right? So that's why gestational sac is not the first definitive sign. Within the gestational sac, the first thing to appear is the yolk sac. That is the first definitive sign of intrauterine pregnancy. Alright? So remember, that's the yolk sac there. Okay, the double deciduous sign. The double bleb sign is basically the appearance of this yolk sac and the amnion. Okay, so that is your double bleb sign. I think it was asked in one of the recent exams as well. Okay, everyone clear with this? So what is the gestational sac? This entire thing containing the fluid, the black fluid, that is the gestational sac. This is the fetal pole. Surrounding the fetal pole is the amnion. Outside the amnion, the small rounded structure, that's the yolk sac, which disappears later on. Okay. Let's go to the next question. Structure labeled 7 is which of the following? Which is the structure labeled 7? This is the structure labeled 7. So what is this structure here? What do you think is that structure labeled 7? Okay, many of you have got that right. Very good, Sneha, Sudha, Milind and Anil, Lakshmi. Let's see, this is not your left common carotid. It is your left subclavian artery. Okay, this is your left subclavian artery. Now, what is this image? This again is a CT scan. The bone is white. Contrast CT, the vessels are white. This is a contrast MRCT. You can see the lungs. So basically, it's a CECT of the chest, right? This, the section that we have taken, how many vessels can you see? This is the first vessel, second vessel, third vessel, fourth and fifth level. So this is called as 5 vessel section. Okay, the level of the 5 vessels. Now, how do you identify these 5 vessels are? These 3 vessels that you are seeing, 1, 2 and 3. Basically, these are the branches of the arch of aorta. Let me try and zoom this image. Okay. So, look at the image here. Look at the image here. This one which you see, the 3 vessels that I have labeled, these are the branches. Okay, Nuzhat, is it clear now? So, these are the branches of the arch of aorta. The 3 branches of the arch of aorta. This is the right side of the patient. This is the left side of the patient. Right? Not our right or left, patient's right and left. Uske baad mein, the first vessel that you see on the right side, the branch of aorta. What are the branches of arch of aorta? Remember ABCs. That is arch se aata hai BCs. That is your brachiocephalic trunk, common carotid and the subclavian, BCS. Okay, you can also remember as Bachelor of Computer Science. BCS are the branches from right to left. So this one, the rightmost, that is going to be the brachiocephalic trunk. This is going to be the second one is your carotid. Third one is your subclavian. So B, C and S. The C and S is of the left side, not of the right side. Because this brachiocephalic trunk, brachio and cephalic. Brachio going to the upper limb subclavian. Cephalic is your carotid. The brachiocephalic gives your right subclavian and the right carotid. Right? So this is your brachiocephalic, left common carotid and left subclavian. That is what is asked here. Structure label 7 is your left subclavian artery. Now, these two vessels here anterior to the artery. Remember that generally anterior to the arteries, we have the veins. Veins are located anterior and generally to the right. Right? IVC is to the right of aorta. Veins are generally on the right side. So, these two vessels that you see here, these are the veins. These are the two veins which unite to form, as we'll take the below section, we will see they unite to form the superior vena cava. So what are these two vessels? The right brachiocephalic vein and the left brachiocephalic vein. The right and left brachiocephalic, not the jugular, right? The right and left brachiocephalic unite to form the superior vena cava. So this is right brachiocephalic, this is left brachiocephalic. Is that clear with everyone? Okay, so remember this is your 5 vessel view. This rounded structure in the center, air containing, that is the trachea. Okay, let me label this for you. So this rounded structure in the center, air containing, that is the trachea. The collapsed structure posterior to the trachea, that is the esophagus. This is the right brachiocephalic vein. This is the left brachiocephalic vein. This is our BCS, the 3 vessels, and these are the veins. Okay, the right brachiocephalic and the left brachiocephalic. Okay, clear with everyone? Which right brachio is not seen, Nuzat? Are you telling me about the contrast, the white color? Are you talking about the contrast? Yes? Why is it not appearing white? Are you talking about that? Brachiocephalic दिख तो रही है. ये तो है ये brachiocephalic. Okay. All right. Absolutely right. So, what we need to do now is, because guys, 8:45 we have the open house scheduled on the Unacademy app, where we have Ask Me Anything session. You can ask me any queries related to your preparation. If there are no queries, then there would be their long dose of motivation. Otherwise, there would be a short dose of motivation. So, since we have that open house scheduled at 8:45, so we need to pause for the session for today. Right, so we have tomorrow emergency radiology top 10 images, and we have KBMD at 5 p.m. the Fast 5 clinical. All these are free sessions. Even open house is a free session available to everyone. All right, the link has been shared on the Telegram group as well. You can join in for the open house and let's have some candid talk. Open house is basically a podcast, an audio that you listen to. You can take a walk and you can listen to me during that, right? So, number 5 कौन सा है? Brachiocephalic trunk है ना, number 5, ठीक है? So, let's meet in the next 5 minutes on the Unacademy app for the free open house session. That's a podcast, Ask Me Anything, right? Till then, have a short break of 5 minutes and I'll see you again together. Till then, goodbye, take care and keep studying, keep revising and keep winning. I'll see you in the next 5 minutes and tomorrow at 5 p.m. for the special class on the Unacademy app. Thank you so much everyone and take care. Thank you.